they last and loosening and so forth. I feel these things are reassuring. So in our community, if we look at the indications, most have been for osteoarthritis, cuff tear arthropathy. The true number would be higher than that, but we didn't start listing that as a specific diagnosis until the registry had been going for a few years. This is an interesting graph, the percentages of different types of shoulder prostheses year by year. And what I want you to have a look at here is this green portion. This is the reverse. So you see how that's really expanded now to being more than 2/3 of all arthroplasties performed in the year 2017. And this has been, if you like, at the expense of the hemiarthroplasty, where those numbers have really, really decreased, whereas anatomical total has stayed pretty constant. And I've shown this already, the mean Oxford scores with arthroplasty types. So the total shoulder still outperforming the reverse as far as the outcomes. Of course, the indications for the patients are different. And this here, the survivorship curves. Let's have a look at this. This is really interesting. In the beginning, in the first few years that we were collecting data, I was having a close look at the reverse and seeing that it had a higher revision rate than the anatomical total, and the anatomical total being this blue line here. And sometimes people would say, look, I'm just going to go straight to reverse in an older person because, you know, it's done and their cuff might wear out and this and that. But I said, look, our outcome's better for an anatomical total if we feel they have a balanced shoulder, and the revision rate is lower, but these lines have crossed. And so now the reverse is really looking pretty strong in that survivorship. So it always pays to keep an eye on things because something new might come along that's interesting. And in 1948, there weren't many Indians in New Zealand, and at one of the traditional boys' schools, the white boys got a bit of a shock when Dad won the 100 metres. Thank you.